Hello, everyone. Thank you for coming to join me today. My name is Shannon Bruce, and today we are going to be talking about what happens to women in cases where they want an abortion but can't get one. In 2022, Roe v. Wade was overturned, banning abortion in a lot of states and putting stricter laws on abortions for women. And it's become harder, especially in certain states, for women to get abortions. So that is what we are going to be talking about today and take a deeper dive into all of that. So before we get into that, we're just going to do some background information just so that everything is understandable. So first, we're going to be talking about what exactly is an abortion. So abortion has become one of the most controversial issues in the United States up to date, and especially in biomedical ethics. Abortion is the termination of a pregnancy before the fetus is viable, which can be done spontaneously or intentionally. Spontaneous abortions are also known as miscarriages. A spontaneous abortion can occur for many reasons, such as disease, trauma, genetic defects, and so forth. Induced abortions are when a pregnancy is intentionally terminated and often voluntary. Now, there is one more that I didn't mention on here, and that one is therapeutic abortion. Therapeutic abortion is performed to preserve the life or health of the mother. Most people do believe that therapeutic abortion to be morally permissible. So now that we have a more clear understanding of what abortion is and the different kinds of abortion, we're going to take a look on some religious views of abortion. So the Hebrew and Christian scriptures do not denounce abortion and do not suggest that a fetus is a person. Next, in Judaism, a fetus has immense worth as a potential human life, but it becomes a full human person only at birth. In Jewish law, abortions are allowed if the fetus threatens the life or health of the mother, but they are disallowed for fetuses with genetic imperfections. Basically meaning they allow abortions if it is threatening the life or health of the mother, if the mother is sick or she could die from having this child, but they do not believe in having an abortion if you don't want to have your child anymore because you find out that it has any genetic defects or something possibly wrong with the child, or a sickness or a disease or something of the sort. Christians have generally condemned abortion through their ideas about the personhood of the fetus have changed throughout the centuries. So it's kind of still up in the air about that one. If we look in the top right corner, we do see we have a little graph right here that shows the slight majority of Muslims, like Catholics, favor legal abortion in most cases. So next we're going to take a look at utilitarianism applied to abortion. So a utilitarian can argue that abortion is morally permissible because without this option, women in society would suffer terrible consequences. Utilitarian arguments for abortion can also appeal to the quality of life of the infant or child. By this reasoning, abortion may be acceptable if the fetus is likely to be born with severe defects, essentially without a brain, terminally ill, intellectually disabled, or physically disabled. Abortion would be a way to avoid great suffering. Next, we're going to take a look at Kantianism applied to abortion. So in Kantian ethics, much depends on whether the unborn is to be considered a person. If it is a person, it has inherent worth and therefore cannot be treated as merely a means to an end. It cannot be killed just for the convenience of the mother or of society. But if the unborn is not a person, then abortion would seem to be more easily justified. Since the woman is a person, she has a right to exercise her autonomy over her own body, which may include ending her pregnancy. So now next we're going to take a look at Roe v. Wade. As most of you do know, in 2022, Roe v. Wade was overturned. So Roe v. Wade was basically the case that did legalize abortion. The Supreme Court decided that the right to privacy implied in the 14th Amendment protected abortion as a fundamental right. Roe has come to be known as the case that did legalize abortion nationwide. At the time the decision was handed down, nearly all states outlawed abortion except to save a woman's life or for limited reasons such as preserving the woman's health or instances of rape, incest, or fetal anomaly. So now, for the next slide, we're going to talk about how Roe v. Wade was just recently overturned in 2022. It is still a very heavily spoke about topic today in politics and just in general. So the U.S. Supreme Court overturned Roe v. Wade in 2022 of June, ending the constitutional right to abortion and federal protection of abortion rights. The decision in Dobbs v. Jackson Women's Health Organization allows states to create their own abortion bans. And what this has led to is abortion bans in 14 states, along with 11 states having placed restrictions on when a person can have an abortion. Abortion deserts, meaning regions without an abortion clinic within a day's drive, have spread across the country, especially in certain states where it is now legal, and increased difficulty with some communities. So abortion has become even more difficult for communities that already face barriers to healthcare, such as the Black community, Latino and Indigenous communities, rural communities, and immigrant communities. And then next here we just have a picture of all different states that have and where they stand with abortion. This map is from 2022, so it is a little outdated, but this just can kind of give you a clear view. So states that are light blue, like Texas over here, have trigger law bans abortion, and then we have the ones that are the dark blue, that basically have abortion legal throughout pregnancy. So it is still the same. As we could see, some of them are a little different. Pre-Roe ban could take effect, or new ban is likely in ones that are like a little lighter than the light blue, a little darker, than the light blue. So they're basically not there yet to having a full trigger ban, but they are close. So next we're going to take a look at some statistics and reasonings. Over half of women having abortions are under 25 years old, and almost 1/5 of these women are teenagers, so still very young to have children. 57% of abortions are performed on women who have never married, 17% on married women, and 16% on women who are separated, divorced, or widowed. And then over here at the bottom, we do have a survey of women who had abortions and the reasons why they did. So 74% of women decided to have an abortion because having a baby would change their life, interfere with their education, employment, etc. 73% also said they couldn't afford a baby currently. They're unmarried or unemployed. 48% also said that they did not want to be a single mother or they were having relationship problems. 11% said that their relationship or marriage may break up soon. 38% said they've already completed their childbearing, so they already have children and they do not want any more. 14% said that their husband or partner wants them to have an abortion. 13% said there are possible problems affecting the health of the fetus. 12% said there are physical problems with their health. 1% said that they were a victim of rape, and less than 5% said they became pregnant as a result of incest. So these are just some reasons. These are more or less the generic general ones, but there are also multiple reasons. Everybody has their own reasons for doing what they do, and obviously not everybody wants to share that, but these are just some of the more common ones. So now we're actually going to talk about some things that can happen to women who can't get abortions. Starting off with health risks, women who are denied abortion care are more likely to experience poor health outcomes such as gestational diabetes, gestational hypertension, and eclampsia. They may also be denied emergency care in life-threatening situations. The next thing is financial consequences. So women who are denied abortions are more likely to experience poverty, increased debt, and lower credit scores. They may also be more likely to be unemployed, evicted, or bankrupt. And then finally, we have child developmental outcomes. So children of women who were denied abortions are more likely to experience worse developmental outcomes and child poverty. And to touch on the first topic here, which I think is the most important one in this case, which is the health risks, we are going to take a look at a case where a woman did need to get a medically induced abortion from a doctor to save her life and was not given that, and in the result of that did end up passing away. So this is the case of Amber Nicole Thurman. I do have the link to the full article right here down below if you would like to read it, the full thing for yourself. But right here, I just kind of have the basics of what happened broken down. So, Amber had taken abortion pills and encountered a rare complication. She had not expelled all of the fetal tissue from her body. So, basically, instead of going to a clinic and having the surgical abortion, she decided that she was going to do it herself at her house and do the oral abortion with the medication, and she was not able to get all of the fetus out of her body. I do just also want to preface this by saying this is in the state of Georgia, where right now abortion is completely illegal unless deemed medically necessary to save the mother's life. So just keep that in the back of your mind while we continue reading. She showed up at Piedmont Henry Hospital in need of a routine procedure to clear it from her uterus called a dilation and curettage, or known as a DNC. But just that summer, her state had made performing the procedure a felony with few exceptions. Any doctor who violated the new Georgia law could be prosecuted and face up to a decade in prison. Thurman waited in pain in a hospital bed, worried about what would happen to her 6-year-old son. As doctors monitored her infection spreading, her blood pressure sinking, and her organs beginning to fail, it took 20 hours for doctors to finally operate. By then, it was too late. Tasked with examining pregnancy-related deaths to improve maternal health, the experts, including 10 doctors, deemed hers preventable and said that the hospital's delay in performing the critical procedure had a large impact on her fatal outcome. So once again, this goes back to the health risks, that we did speak about before, where women in a case where they need to have an abortion but can't due to health risk could result in death, especially in states like Georgia and Texas where abortion is completely legal. Not only are they not allowed to go seek an abortion anywhere in the state, and not only is it punishable um, as a felony to them, but also to any doctor that would do this procedure. And in this case, doctors did not want to do the procedure because they did not want to face a felony, because they are only allowed to do these procedures unless it is deemed absolutely necessary to save the mother's life. And in the beginning time, they didn't think that it was necessary. And then when they did, it was too late. And this resulted in the passing away of Amber Nicole Thurman. So like I said, if we just go back quickly to this slide, these are just some of the potential things that can happen to women who can't get abortions. And it's not fully all of the reasons, but I feel like some of the main points that do stand out. This does not touch on anything in terms of mental health and how this could mentally destroy a woman's mental health, especially if she already has prior mental health issues like depression or anxiety or bipolar disorder, and then now has to bring a child into this world and is forced to carry a child. And with, as many people are also familiar with the term, postpartum also comes with bearing children. So it is definitely not for everyone. So I do firmly believe that, abortion rights are human rights, and that every woman should have their own right to an abortion if necessary, if they feel that they need one, and it should be left up into the hands of a woman at the end of the day and not the government to make choices for our own body. So that is all that I have for today. Thank you guys for listening.